Greetings. I'm Monica Offrey with Healthcare for All Minnesotans. If you're here, it's because you're interested in telling your story about healthcare. I'm going to give you guidance on how to create an impactful narrative with the goal of sharing with your family, friends, neighbors, and ultimately your legislators. Your story matters. Legislators make decisions based on data, budgets, and reports, but your personal stories show them the real-world impact of our healthcare system. By sharing your experience, you help them understand what's working and what's not, and how the Minnesota Health Plan could make a big difference. This guide will help you reflect on your own experience and tell your story in a clear, powerful way. We're going to go through 3 steps: reflect, connect, and add a policy piece. First, reflect. This is the brainstorming part where we think of personal details and add the feelings behind the what happened. Then we're going to connect. Think about your fellow Minnesotans. Are they subject to the same situation that you went through? Third, we're going to add the policy piece. Let's direct your legislator to the solution for the issues you've just illustrated with your personal story. Then we're going to tie it up in a nice little bow. Here are some tips. Keep it short and keep it real. Your whole story can be written in just 1 to 3 paragraphs. What matters most is authenticity. A simple structure: what happened, how it affected you, how the Minnesota Health Plan could have helped, and why you're speaking up. That's it. You don't need statistics or policy language. Your lived experience is powerful on its own. First, let's reflect. Let's just think about some healthcare situations that may have happened to you, and perhaps it will spark something from your experience. So after I recorded last night, the main part of the guidance of writing your own story, I had a lot of thoughts. In fact, they were sparked by going out to brunch with my daughter and husband this morning. I overheard a conversation, and yes, I know eavesdropping is wrong, but there was a gentleman talking to his friend about a new job opportunity that he had that offered better health benefits and more pay. But he was hesitant to take the job because it wasn't the work that he wanted to do. He would be further away from the clients that he would be working with, and he felt like the job would be less satisfying. I too have felt that same struggle of trying to find a job that had good benefits. When I was first out of grad school, I worked for a startup company, and they could not offer health benefits. I was able to work for them, however, because my husband had benefits. So this calculation of, are we going to have benefits, taking a job for the benefits, would be completely erased with the Minnesota Health Plan. Imagine the boon to business that could create for our state. And we would be the first in the nation to be able to do this. Now, I also think about entrepreneurs. I have 3 brothers. All of them are self-employed. 2 are farmers. 1 owns a tree company, a tree trimming company. So none of them work for companies that offer benefits. They are self-employed. None of them have the freedom to navigate through their jobs without thinking about healthcare. Imagine the amount of freedom, and we claim to like freedom in the United States, that we would have going from job to job endeavor, or thinking up new ways of making money. truly being entrepreneurial without having to think about health benefits. Some other situations that came to mind are my husband. We recently had a life change, which means I had been laid off from my work where we got my health insurance from, and he was covered under that. And then we had to switch to his. This required an entire different network. Now, just a few months later, he had a cough that he was afraid was turning into a pneumonia. Right across the street from his work is a walk-in care clinic. He walked over and received care. He had been doing that for years under my health insurance, but under his health insurance, it was out of network. So we paid the full bill. All of these professionals that were treating us under my previous health insurance went to medical school, were trained, are professionals, but suddenly another insurance company says, no, they're not good enough, or we don't have a deal with them. Deals? Is that how we do healthcare here? Apparently. So I had some other thoughts. When I just had ankle surgery because I'm getting old and my cartilage is deteriorating in my ankle, I had to call my insurance company at the request of my orthopedic surgeon. And he said, just check, make sure I'm in network, make sure the facility is in network, which is apparently two different things. So I called the insurance company and I said, is the facility in network? Let me see. And so they went through and there were several facilities and they made sure that the facility that I was going to was under their plan. Then I had to make sure that he within that facility was also covered, because those can be different and it can change at any time. They can say, whoop, all of a sudden you're out of network. Now let's think about Greater Minnesota. You have a singular hospital that is the closest to you. The next hospital is 40 miles away. Is that hospital in network? Will it remain in network indefinitely? Without the security of the Minnesota Health Plan, insurance companies can change that at any time. Another example, I had a condition for which I was prescribed a medication by my doctor. I was about to go to a conference. I was in grad school, and the doctor prescribed the prescription. I was going to pick it up at the pharmacy, and they said, we can't fill this. The insurance company is not covering it. I called the insurance company, and they said, we generally don't allow this prescription to be prescribed unless you fail on 3 other medications for the same condition. I'm about to go to a conference. I can't be sick. I need to present. And so this really poses a problem about being able to actively engage in my work and my schooling and be healthy at the same time. There was somebody, a pharmacist that I talked to on the phone that said, yeah, we usually like people to fail on 3 different other medications before we recommend this medication. Why would you do that? The doctor said that this particular medication that they were prescribing was exactly what I needed. That should be what I was given. So these are a few of the examples that I just came up with this morning that were jostled from my memory. And I'm only 51. Like, there are more bodily things that are going to happen to me. This container for life is a fallible thing. I teach anatomy physiology, and it's a pretty complicated place where we live. Lots of things that go wrong. In fact, it's kind of amazing that things go right. So let's take care of it. Let's take care of each other. And let's get good health care in Minnesota for everyone. So I hope that this jostled some of your memories, because I bet these are not isolated incidents. Just like the connection step that we're talking about, reflect, connect, add a policy piece. The connection piece, how does this relate to other Minnesotans? You're not alone. I'm not alone. These things happen to all of us. So let's consolidate these things into a quasi-Yelp review for the fragmented system that we call health coverage now, and let's get a solution, the Minnesota Health Plan. Now, looking at this issue you've written, describe how it made you feel. Stress, anxiety, fear, frustration, powerlessness, confusion, or gratitude for a provider that helped you navigate despite the system. Now we're going to connect it to broader Minnesota. After describing what happened, explain why it was a problem. I had insurance, but I still couldn't afford the care I needed. My doctor wanted to treat me, but the insurance company said no. Losing my job meant losing my coverage. I spent more time fighting with insurance than I did healing from my injury. This helps legislators see that your experience is not an isolated incident. It's part of a pattern. And why this matters is that all Minnesota is vulnerable to the same experience that you experienced. So let's look at a few bullet points of what the Minnesota Health Plan could do so that we can tack the policy piece onto your story. With the Minnesota Health Plan, there would be universal coverage. Everyone's covered, no matter their job, income, age, health status. Everyone. Cost would never be a barrier to care. You can see any provider. No networks, no out-of-network surprises. Medical decisions are made by you and your provider. You're in your doctor's office. You never have to wonder, is my insurance going to cover this? The doctor orders it, you get it. Comprehensive benefits, including mental health, dental, vision, long-term care, and more. So ask yourself, which of those bullet points would have changed your experience with the healthcare system? Attach it to your story. Would you have gotten care sooner? Would you have avoided medical debt, stress? Would you have had more choice or control? Write 1 or 2 sentences on how the Minnesota Health Plan would have made things better for you. And ultimately, that's going to be the same across all of Minnesota. If you experienced it, somebody else out there is going to experience it too. Let's save them that pain and suffering and get this legislation passed. Now, tie it up with a nice little bow. I'm sharing this story because no one should ever have to go through this. I want a healthcare system that works for everyone in Minnesota. I hope you'll support the Minnesota health plan so that Minnesota families like mine can get the care that they need. That's all. So what's next? Use your story. Write your legislators and share your story with Healthcare for All Minnesota on our website, either in the written form or record a video if you're more comfortable. Most importantly, come to Lobby Day. When you register on our website, we'll schedule you to a face-to-face meeting with your legislators that represent you. Share your story with them in person. This is most impactful. Find the links to do all 3 of these actions in the description below. Thank you for showing up. Thank you for sharing.